Have you ever been prescribed Tamsulosin, also known as Flomax, or Finasteride, also known as propecia or proscar, maybe for prostate issues or even for hair loss? Today, we're diving into some surprising side effects you should know about if you're taking these medications. We'll also talk about whether those side effects go away once you stop them, so stick around until the end. Let's start with Finasteride. This medication is often used for an enlarged prostate, but at lower doses it's also commonly given to treat hair loss. What many people don't realize is that it can have significant sexual side effects. Finasteride works by blocking an enzyme called 5-alpha reductase, which is found throughout the body, especially in the prostate and even in the brain. Because the medication can cross into the brain, it may reduce certain neuroactive steroids, things like DHT and similar hormones that play a role in sexual desire. Although the exact mechanism isn't fully understood, lowering these chemicals may interfere with the parts of the brain involved in libido. Most of the research on its effects in the brain has only been done in animals, which means we still don't have a complete explanation for why these changes happen. But we do know what people report. According to the medication's own labeling, less than 10% of users experience issues like impotence, decreased libido, trouble with ejaculation, or overall sexual dysfunction. The reassuring part is that if you've already been taking Finasteride for over a year without any problems, you're unlikely to suddenly develop these side effects later on. However, there's another side to the story. A study surveyed 71 men who had long-lasting sexual side effects after using Finasteride for hair loss. More than 90% of them said they experienced low libido, reduced arousal, and erectile dysfunction. Nearly 70% reported difficulty reaching orgasm. The most unsettling finding was how long these symptoms lasted after stopping the medication. The average was about 40 months, nearly 4 years, and about 20% of the men continued to have symptoms for more than 6 years. There's also something known as the nocebo effect. It's similar to the placebo effect, but instead of expecting something positive, people expect something negative. If someone is told about possible sexual side effects, they may be more likely to believe they're experiencing them, even if the medication isn't the direct cause. This psychological piece can complicate how we interpret symptoms. Now let's shift to another group of medications frequently used for prostate issues, alpha blockers. One of the most commonly prescribed is Tamsulosin, and this one has its own set of sexual side effects, especially changes in ejaculation. In fact, depending on the dosage, somewhere between 8 and 18% of men taking Tamsulosin notice a decrease in ejaculate volume, or in some cases, a complete absence of ejaculation. Here's why this happens. These medications block alpha receptors, which are located in the bladder neck and in the seminal vesicles. The seminal vesicles are responsible for about 80% of the fluid in semen. Normally, both the bladder neck and seminal vesicles contract to help push semen out through the urethra. When alpha blockers interfere with those receptors, that squeezing action becomes weaker, and ejaculation can be greatly reduced. There's also a possibility that Tamsulosin affects certain receptors in the brain, like serotonin or dopamine, which may interfere with the brain and spinal cord signals needed for ejaculation. Interestingly, when men are told ahead of time that a medication might affect their ejaculation, about 70% say they would avoid it completely. So if you're experiencing this and you're currently taking Tamsulosin, the good news is you do have options. Other alpha blockers, such as terazosin, alfuzosin, and doxazosin, tend to have much lower rates of ejaculatory issues. Among these, alfuzosin appears to have the lowest rate, at around 0.6%, while Tamsulosin and silodosin have the highest. If any of these side effects sound familiar, don't hesitate to talk to your urologist or primary care doctor. There are alternatives, and you don't have to simply live with the problem. Thanks for listening, and remember to take care of your health. You're worth the effort.